Hello, welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, PharmD. Today, I have a integrative cardiologist with us, Dr. Jack Wolfson. Welcome, Dr. Jack. It's so great to have you here with us.
Thank you, Isabella. Absolute pleasure to see you. And you and I have communicated and done some interviews together over the years. And again, just really appreciate your work and how you're helping so many people. So thanks.
Thank you so much for the work that you're doing. I was just sharing how I always wanted to learn more about cardiology and how you've been able to break this down and really give people the tools that they need to stay heart healthy. Some of the information that's out in the world isn't exactly the best kind of information, and cardiac disease still remains the number one killer. I'm going to give you guys a little bit of a background about Dr. Jack. Dr. Jack Wolfson is a game changer in the world of cardiology, a heart doctor who traded the conventional for the extraordinary. After spending a decade in Arizona's largest cardiology group, performing angiograms, placing pacemakers, and practicing the standard model of care, Dr. Wolfson, the divine, would bring a woman into his life. Dr. Heather, a chiropractic physician, introduced him to a new way of thinking, one that didn't just treat disease but sought to uncover its root cause. In 2012, he founded Natural Health Doctor, a revolutionary practice focused on holistic cardiovascular care, bringing cutting-edge natural solutions to patients worldwide. A best-selling author and sought-after international speaker, Dr. Wolfson has been featured on Fox News, CNN, NBC, The Washington Examiner, USA Today, The New York Times, and The Washington Post. He's been recognized among the top 50 functional medicine doctors, awarded Phoenix Top Doc, and named a top holistic MD 5 times. Beyond his professional accolades, Dr. Wolfson is living proof of his philosophy. Since marrying Dr. Heather in 2007, they've raised 4 children in a way that aligns with their deep commitment to natural health. So thank you so much for being here with us. I know when I was early on in my healing journey, I remember going to fitness classes and then ending up with like horrific palpitations to the point where I had to stop exercising. And for a while, I was like, okay, I just can't do cardio. And when I was struggling with a lot of my symptoms before I was diagnosed with Hashimoto's, I had these palpitations all the time. I ended up having a diagnosis of a mitral valve prolapse, and I remember this was a big thing, and I ended up going to a cardiologist in Phoenix who essentially told me to look at my thyroid, right? And this was something that he thought was like, this is the thing that you really need to focus on. And a lot of people with thyroid issues, they struggle with palpitations. Can you tell us why a lot of people with thyroid and maybe without thyroid issues, why they might have palpitations?
Yeah, most certainly. It's so common that people, and more common in women, are diagnosed with palpitations. And it's unfortunate that very often the medical doctors, the cardiologists, they kind of actually just say, hey, listen, it's not a big deal. Don't worry about it. Maybe they run some different tests. Maybe they find a little bit of mitral valve prolapse. Maybe they don't. A lot of women are misdiagnosed with mitral valve prolapse. They don't really have it. It's just kind of like this whole syndrome that they came up with in the 1980s, this mitral valve, syndrome, prolapse syndrome. But the doctors will say, hey, listen, don't worry about it. But it's affecting a lot of people and it bothers them. That's why they're complaining about it. So we do need to get to, root cause, which I love, of course, your first book talking about root cause. And that's what it's always about. So what we do is that we see these women who have maybe PACs, PVCs, these premature complexes or extra beats, and then we want to figure out why. And we don't want to suppress it with a beta blocker or calcium channel blocker or any pharmaceuticals. It's going after root cause. So yes, the thyroid for sure can be involved in whether it's hyperthyroid, more commonly hypo, as you mentioned, and Hashimoto's, that could lead to the irritability of the heart for a whole variety of reasons that the thyroid is so critically involved in. But ultimately, it's also a matter of, well, what's leading to that thyroid abnormality also affects the heart.
Mm-hmm. It's been really interesting. I've seen some women when they get their thyroid antibodies down or they get their thyroid function normalized, they will say that their palpitations improve. I've also seen magnesium, and there was one person who was going in for a cardiac procedure, and it ended up being that she was low in iron, and correcting that nutritional deficiency helped to correct the cardiac issue. Has this been your experience as well when you find that there are causes that could be corrected?
Yeah, for sure. I mean, there's so many people who have gone for either, pharmaceutical therapy, which again didn't address the root cause, may help the symptoms, may actually make them worse. So for example, if you're on a beta blocker, beta blockers slow down the heart rate. So you can slow down the heart rate that allows those extra beats to jump in there. It's kind of like I think about the carousel or the merry-go-round at the playground. So the when the merry-go-round slows down, you can jump on. When it goes faster, you can't get on. When the heart's going faster, the extra beats can't get in. That's why a lot of people feel better with physical activity, and the symptoms are worse when they're laying in bed. It's all quiet. So again, when the heart slows down and the beta blocker, calcium channel blocker, slows it down more, those extra beats can jump in. Or maybe the women and men go for a definitive procedure, some kind of ablation or something where they would burn the area where this is coming from. And the doctors never, in some cases, never even check thyroid function, certainly didn't think about iron or zinc or copper or different vitamins that could be playing a role. You mentioned magnesium. What about, magnesium? What about potassium? What about all of these other electrolytes that again that they're not looking at? Omega-3 fatty acids. What about all the environmental toxins that are interfering with not only thyroid function, but cardiac function as well? So that's the beauty of what we're talking about right now. It's always telling people, hey, just go that one extra step. Keep digging deeper and deeper and deeper. There's a time and a place for pharmaceuticals and surgeries, but it's at the end of the game, not at the beginning of the game. So you got to work with a practitioner who is skilled at finding the root cause.
Yeah, that's such a great point because sometimes I feel like I love conventional medicine for so many reasons, but it's also very frustrating because you'll have like the left hand doctor only looking at your left hand and your right hand doctor only looking at the right hand. I used to work with psychiatrists and I would say, hey, are you seeing this patient? It affects her, increasing your patient's blood pressure. And they would say, well, I don't check my patient's blood pressure. And it's kind of like, okay, well, sometimes the person would get started on one medication for their quote unquote depression, and then they'd have to get on a medication for high blood pressure thereafter. And it was like this prescribing cascade that I would see as a pharmacist, where perhaps maybe if you looked at, I don't know, a nutrient deficiency or a thyroid function, you might actually be able to resolve the depression in the first place. So that's been my frustration with conventional medicine. It's basically this prescribing cascade, and we're never looking at the whole person from a conventional medicine standpoint. But I really love integrative and functional medicine because you're a cardiologist, but you're not just looking at the heart, right? You're really looking at the full body function to see what's contributing to people's cardiac issues.
Yeah, I mean, you have to look at the whole person and all different, organs, and the specialists like myself in the hospitals. When I used to work in the hospitals, we're famous for that, right? You go in there and you're laser focused on the heart, and then the lung, doctor comes in and she's focused on the lungs, and the kidney doctor comes in and he's focused on the kidneys, and it really is all about, yeah, like you said, just focusing on all these things. And I do want to, sometimes I tend to bash the medical community pretty good, my fellow MDs and DOs who were in that system, and God bless the men and women who work in emergency rooms and trauma centers. But when it comes to the prevention, treatment, reversal of chronic disease, they have nothing. They have nothing in their toolbox. All of the statin drugs, all of the aspirin, all the various blood thinners and diabetes drugs, and like you mentioned, psychiatric medications. And it's just the way that we're trained, right? I mean, the way that you were trained in pharmacy school, and the way that I was trained in osteopathic school, and you and I were in the same location in Downers Grove, Illinois. I was there years before you were, but it's unfortunate that the way that they get trained is has been a problem for many years, still is. And it's not about, again, as we kind of allude continuously to that root cause, it's always about digging deeper, why these people are having these things. And again, the medical community just has nothing in that arena.
If somebody were coming to you with palpitations, would you give them a checklist of things that they should look into?
Yeah, most certainly. The philosophy that we use at Natural Heart Doctor is what we call the 100-year heart method. So, uh, you know, just as you do, and just as kind of a lot of us functional medicine practitioners are the eat well, the live well, the think well. And then you do the most advanced testing in the world, including obviously advanced thyroid assessment and stuff like that. In that testing, we're also looking at toxins, all of the different pesticides and phthalates and plastics and PVCs. And those are just the P words, let alone all the other mold mycotoxins, bacterial toxins, so many different things in the toxin category. And then you get the, evidence-based supplements and the biohacking strategies. But that's like the foundational stuff. And then, as we mentioned before, if all of that does not fix the problem, which pretty much it always does, but if it doesn't, then you can reach into, the pharmaceutical toolbox if you need to. Or, again, in my realm, a lot of people have what's called atrial fibrillation. They've got, they're scheduled for an ablation, and I'm okay with ablations, but it's got to be, again, at the end of the game in the right person, not in the beginning.
Thank you for sharing that. Um, can we talk a little bit about cholesterol? This is such a hot topic, and I know I have a lot of people who, one, we know that hypothyroidism can cause elevations in cholesterol, and sometimes correcting thyroid function can normalize cholesterol, but there's more to the cholesterol story than just statins. I was hoping that you could break that down for us. Should people be worried about high cholesterol? What are optimal values of cholesterol? If somebody does have high cholesterol, what do they need to look into? Should everybody be getting a statin in their water? Like, should we just put it in the water supply?
Well, certainly a lot of cardiologists believe that the statin should be in the water supply. They'll also say, "Well, you should take it because I take it, and my father takes it, and my mother takes it." I'm not a statin guy. I mean, I used to be. I was a hospital-based cardiologist in the biggest group in the state of Arizona, dispensing statins like candy. In fact, Lipitor is the number one selling drug of all time, and it's a sham. It's so unfortunate. It is really one of the biggest, I guess, fallacies and mistakes, if you will, misdirections over the last, 40, 50 years. I think there was another one that was more recent than that, that was the biggest misdirection of all time. But statins are right there with it. So, what I would say again is that people are not deficient in statin drugs as a cause of heart attacks. There's a root cause of why they have heart attacks, violations of the eat well, the live well, the think well. That's what it is. And as it relates to statin drugs, there's three problems with it. One, they don't really work like they say they do. Number two, they have tremendous side effects, including thyroid dysfunction in a lot of people. And then number three, the statin drugs provide that false sense of security. Hey, it's in the drinking water. You're fine. Eat, live, and think however you want. And that's just a monumental mistake that people make relying on the statin drugs. The most recent meta-analysis regarding statins shows that for primary prevention, meaning someone who's never had a heart attack or stroke, statin drugs lower the risk of heart attack by about 0.14% on an annual basis. 0.14%, which means that if you take a statin drug, you can enjoy lowering your heart attack risk from 2% to 1.86%. And if you are listening to this and you think that that's good and you want that, then go get that. But if you're part of, Dr. Izabella Wentz's tribe, Jack Wolfson's cardiology tribe, you don't want a 1.84%. You want a 0% chance or close to it risk of having a heart attack. And that's that's where the statin fallacy, begins. So as it relates to cholesterol, it's real simple. Cholesterol is a life-giving substance. It's involved in every single cell function, as you know. All the cells of the thyroid and the cell membrane are loaded with cholesterol. We need that. So we should embrace cholesterol for all that it does in the cell membrane. All of our hormones come from cholesterol. Vitamin D, of course, the hormone, which is vitamin D. Everybody knows vitamin D is very important. How do we make vitamin D? The sun hits cholesterol coursing through the skin. It turns the cholesterol into vitamin D. Vitamin D goes up, cholesterol goes down. All of our digestion, our bile from the liver, it's all loaded with cholesterol. So cholesterol is such a very important molecule. It's been vilified only to sell pharmaceuticals.
Yeah, it's interesting because I know that cholesterol is required to make hormones, right? And sometimes that increase in cholesterol is a sign from our body that, hey, we need more hormones. And whether that's like, hey, we need more thyroid hormone on board. Sometimes I see people with adrenal issues or in their like stress response where they'll have elevations. What do you tell people who are concerned? Maybe they have elevated cholesterol and their conventional docs said, "Okay, you need a statin because your cholesterol is at, 250."
Yeah, that's a great point. As far as where we would like, when we see abnormalities of cholesterol, and of course the definitions for what's abnormal are all set by the pharmaceutical companies. We know from the Mr. Fit trial that the sweet spot for total cholesterol is 160 to 260. So when we do see, I guess, abnormalities, or whenever we think about what our total cholesterol should be, more importantly, lipoprotein ratios like apolipoprotein B, A ratio, the lower the better there. But we should always think about if it's abnormal, it's not a statin drug deficiency. There's a reason why it's abnormal. And to your point, if the body is struggling to make hormones, one of the natural responses of the body is to produce more of the precursor to that in an effort to say, hey, we're not making enough. Therefore, let's make more cholesterol because we want to make more testosterone or estrogen and progesterone or aldosterone or cortisol in the case of stress. So we produce more of it. Now, cholesterol is a very important part of our immune system. So if we are immunocompromised, if we are under attack by these environmental toxins, pollutants. Again, that's a reason why cholesterol could go up. And then in addition, when cholesterol is made, it has to be cleared. And this cholesterol is made, is put into LDL particles. The LDLs travel around the body, getting the job done. But we need to clear out those old LDL particles. But when the liver is congested, it's toxic. In addition, all those things that would lead to reduced thyroid hormone and reduced thyroid function. All these things are all interplayed together, as you know, so delicately. So now the body does not clear the old, small, dense LDL particles. They circulate around and they can wreak havoc and cause heart disease as well. But the primary problem why heart attacks happen has nothing to do with cholesterol, has nothing to do with LDL particles, which all animal species have, because there's a purpose for those, and we need to focus on that purpose.
I know some people will say, "Hey, I have high cholesterol, so I'm going to go on a vegan diet and I'm going to stop eating eggs." What's your take on that?
Yeah, I think that's a huge mistake, as I know you agree with. Yeah, I'm not into the vegan diet. I think it's deprivation. I think it's starvation. I think it's a horrible approach. Obviously, other people have different opinions. There was the recent the head of the American College of Cardiology. His name is Kim Williams. And he is a big proponent of the vegan diet. And I think it's a huge mistake. Our ancestors ate a certain way. They were hunter gatherers. The eating meat is mentioned around 300 times in the Bible. So our ancestors clearly ate that food. I think seafood is the healthiest food on the planet. I think that free-range grass-fed meats, of course, are right after that, including the organs, including eating thyroid. Actually, my wife and I recently, I did a social media post about us frying up the thyroid, bison thyroid in grass-fed butter and eating that, and our kids eating that as well, just like as our ancestors did, or like an animal in the wild would do. So
Old school glandulars.
the old school original glandulars. And I think when you do some of that behavior, it really negates the need sometimes even for, supplementation or the pharmaceutical approach. I mean, it's just one strategy for people to try, or maybe one could lower the dose, or maybe one would feel better because they're getting in that, yeah, true, in that old school glandular approach. Not something we do on a daily basis. And obviously, as you know, and you're right about, it's a lot more complex than that. But um, Yeah, the idea of the vegan is just such deprivation. We know the people, for example, who have the highest levels of omega-3 fatty acids have the lowest risk of everything: heart attacks, dementia, atrial fibrillation, infections. So we want to get those omega-3s, and we get them from eating seafood. People try to get them from flaxseed and walnuts, chia seeds. It's just the body is very poor in conversion. There's an enzyme called delta 6 desaturase, which helps to make that conversion. Again, it does so inefficiently. And of course, in the hypothyroid person, it's definitely, not going to happen. The thyroid, as you know, of course, and talk about, it's the spark plug of the body. And if you're missing the thyroid function, you're not going to be able to make any of these processes happen. So, yeah, vegan. And as far as, I mean, eggs are a cocoon for a baby chicken, all the vitamins, minerals, proteins, and fats that a chicken needs to come to life. We're a huge fan of wild salmon roe. Same thing. I mean, just everything inside of that salmon egg just does such miracles to the brain, to the body. So yeah, big fan.
Interestingly, when I started working with clients, I had a lot of people who switched from the vegan diet into eating meat, right? And they would eat grass fed meat. And one of the big life changing things was that they started eating beef and red meat. And at first I was like, oh, they were iron deficient. Maybe that's what they needed. And then I learned about carnitine. And carnitine, one of the richest sources, is in red meat. And this is a something very, very helpful for thyroid function and fatigue and brain fog. It's also helpful for the heart as well, right?
Yeah, carnitine, carne, carne is meat. Comes from the Greek, root for meat. And it's it is very exciting because listen, these people, and maybe in particular women, they're struggling to find answers, and one direction will lead them into the vegan. Somebody will talk about how they did so much better on vegan, and maybe in fact they did, because if you're coming from McDonald's cookies and cupcakes and you switch over to veganism, you may do better, but then eventually those people, they burn out, right? So by getting some of these amino acids, of which carnitine is very similar, to, it is a protein, and that protein is going to be the best source is going to be animal products. Where you get that, you're not going to get that in the vegan or plant world. And L-carnitine, for example, as a supplement, is proven to help support people, really mitochondrial. It's really going to be a mitochondrial fuel, and it's proven for people with congestive heart failure, for example, to improve with carnitine supplementation. But yeah, you can just do it, right from the food, and just get tremendous benefits. But I'm not, as much as I'm not the vegan cardiologist, I'm also not the carnivore cardiologist. A lot of people do find improvement on carnivore, but I don't think it's a good long-term strategy. Pure carnivore certainly would likely lead you to ketosis, and I don't think ketosis is good as a long-term strategy for the majority of people either. So we were hunter gatherers, and that's how we should approach it. One of my favorite examples of this is the movie Castaway with the actor Tom Hanks. And it's like, Tom Hanks, he's in an airplane crash. He winds up on the remote island. So on the island, he goes to sleep with the sun down. He awakes with the sunrise. He spends the day in the sun. He's wearing a loincloth, so he's getting that sleep. He's getting that sun. And then he's eating fish, avocados, and coconuts on the island. And there's, you would say there's basically no pollution on that island. So if we all lived like Tom Hanks did on the island, now he suffers from being lonely. And as you know, as far as mental health is concerned, that's so catastrophic to be alone and socially isolated. That's really problematic. But my point is that if you eat well, live well, and you think well, that's the strategy. One thing that I like to make very clear is that everyone's genetics are perfect. Your genetics are perfect. My genetics are perfect. Everyone who's listening, their genes are perfect. However we got here in the image of God, or in the evolutionary model, whatever it is, we got here perfectly. We can run and jump and see and feel, and make babies. We can do some pretty impressive stuff. Why would we be genetically programmed of heart disease or thyroid disease or cancer? It doesn't make any common sense. But unfortunately, the medical community, they're not taught that. Or if they are taught that, they don't want to teach that, because then it implies that there's something you could do about it if you say, well, it's not your genes. If you blame it on the genes, then you'd say, well, you know what? You've got genetics, you've got the family history of heart disease, nothing you could do. It's in your genes. It's in your, family history. What are you going to do? You got to take a statin drug. 100 million Americans have high blood pressure. Do they all have bad genetics? Like 1 out of 3 people, heart attacks are the number one killer. There's no heart attack gene. There's no heart attack gene. There's no high blood pressure gene. There are genes that could predispose people if you turn the genes on by not eating well, living well, and thinking well.
Yeah, it's interesting that so many diseases they say were genetically programmed, but yet it's not like we've evolved so much in the last 50 years or 100 years. I grew up in Eastern Europe. I grew up on the Ukrainian border in Poland, and Chernobyl happened, right, when I was a young child, and the children closest to Chernobyl ended up with thyroid disorders. And genetically similar children, on the other side of Ukraine, right? You think they'd have similar genes. They had far lower rates of autoimmune thyroid disease, thyroid cancer, so on and so forth. And I feel like conventional medicine just sort of overlooks that, and they're like, we're just going to make you the best drug in the world to take care of your faulty genes, right? But what actually leads to high blood pressure, and what are some of the natural treatments?
Yeah, so high blood pressure, it's really just, kind of like abnormal cholesterol, if you will. It's just a sign something is going wrong. It's clearly a sign. And the idea is to find out why the blood pressure is going high, what's faulty in the body, where are you getting the wrong foods, where are these environmental toxins coming from, where are these stressors coming from, where is this lack of sleep coming from, lack of sunshine, coming from, all these different things. And obviously, this all plays into your specialty, thyroid, adrenals, hormones, it all plays into it because you would say, well, yeah, if the thyroid's off, does that lead to high blood pressure? Yes. If the adrenals off, on and on and on, but it's still going to be, yeah, how do we address really that root cause of why the thyroid, adrenals, the hormones are leading to high blood pressure? I'll be very clear about this. If you are on a high blood pressure drug, you are on the path to dying, to heart attack, to stroke. It doesn't work. It may lower your numbers down, just like cholesterol drugs lower the numbers down, but you don't get any awards for having lower numbers. You get awards for what you really want is to live long, live well, and not have a stroke, not have a heart attack, not have cancer. And the pharmaceutical approach is it's just wrong. It just doesn't work. Obviously, it's got tremendous side effects. Obviously, it leads, as we said, to the false sense of security, and there's just so much data. But unfortunately, the medical doctors, they'll come in and it's not their fault. I mean, they're not bad people. As you know, they're just not trained that way. They're not trained in root cause. It's not that they're not intelligent people. They're intelligent people. But it's like if you and I went to Poland and we're walking around, Warsaw or Krakow, and someone speaks to me in Polish, and I'm like, "What? I don't, I know a couple words, in Polish from practicing in Chicago, and some of the Polish, people there who tried to teach me to speak a few words. Uh, I'm not an idiot. I was never trained to speak Polish. So these medical doctors, they're just not trained in root cause, as you know, from day one. Because we had joint pharmacology classes at the same time, and it's all and really one of my favorite moments was writing that first prescription. How amazing that was! But again, as you look back, it's just the total indoctrination of the doctors. It's all true. It is all a conspiracy, and it's one of those conspiracy theories that's totally true. So if you're on a high blood pressure drug, you must be on a program to get off of that drug as soon as possible. It will lead to failure.
Well, I feel like in conventional medicine, like we do things that look good on paper. So we know that high cholesterol and high blood pressure, these might be risk factors. So they're like, well, how do we modify the risk factors? And instead of being like, hey, when somebody is stressed out, this leads them to have a lot of cortisol, which then can lead to high blood pressure. They're like, we're not going to deal with the stress. We're not going to even think about the cortisol. But what we can do is give you a pill to lower your blood pressure. And it's like they try to correct everything on paper with the human body doesn't work that way, right? I know I see a lot of ladies with adrenal dysfunction. It's like a common thing with Hashimoto's, and we could really give them supplements, medications, all of that to lower their cortisol or increase their cortisol. That's one way of doing it. But I found the best way of doing is like teaching lifestyle, how to de-stress, right? And so we're focusing on like circadian rhythm balance, and we're focusing on make sure you get good sleep and do your breathing exercises, do some yoga, do some trauma work, and doing all of these things. And all of a sudden it's like, okay, then the cortisol normalizes and the blood pressure normalizes. And I find that is a much more effective approach than just doing things on a piece of paper, right?
But it makes common sense, right? I mean, just after all of the pharmacology training that you had, and after everything that I went through, and then you wake up into this reality of just common sense. Like, why wouldn't any and every medical doctor say that as a first approach? You have to get good quality sleep. And yes, of course, people with thyroid dysfunction, adrenal dysfunction, yes, they have trouble sleep. But again, like that's still the focus as to, okay, well, let's get that quality sleep. How do we spend more time outdoors like Tom Hanks in the movie, getting that sunshine onto the skin? The skin is a solar panel built to collect light. Yet most people sit inside all day long. They're from Poland, they're from Chicago, they're from these colder places where people just don't get outside. Now, our ancestors in Poland and Russia and all over, they were outside all the time, but not anymore. So now you don't get that sun. The sun helps to create nitric oxide. You mentioned natural strategies to lower blood pressure down. Well, not only does the sun create vitamin D when it is summertime, for example, you do need optimal seasons to get the vitamin D. And you can also get vitamin D from animal, foods. So vitamin D lowers blood pressure. Vitamin D receptors are located all over the heart on every single cell in the blood vasculature as well. So you need good vitamin D, that'll lower blood pressure. The sun also, through UVA, ultraviolet wavelength A, helps to make nitric oxide. So you have stored nitrates in your skin. The sun hits it, releases it as nitric oxide, opens up blood vessels. The other thing sun does also is that it helps to prime the production of melatonin, which helps you sleep. So all just works perfectly together. It's also common sense, and it's just unfortunate that so many people just do not get that message.
Do you recommend a beach vacation as a part of a health wellness routine for people? I know people in Phoenix and Texas, California, like we step outside and we can get some sunshine, but what about our friends in Chicago?
Yeah, I love that question too, because you and I both spoke all over at different events, and you talk to these people, and they're like, "What do I do? I live in Chicago, I live in Boston, I live in New York, I live in Alaska, I live in Canada, Russia, Norway," and they're like, "What do I do?" And we're like, "Move." But, I mean, it's real simple. Just move to Costa Rica, move to the Southern Caribbean, move to Greece or Italy, move to some equatorial area. And then they'll come back and they'll say, no, I can't do that, right? My family, we got the grandkids, I got my job, or I just love Chicago. And I totally get that. But if you want the best advice, that's the best advice. If you're looking for health, I said this when I spoke of the truth about cancer years ago. I said, you cannot heal in the same environment where you got sick. Now, it doesn't mean you necessarily have to leave your home, but it means you need to change up various things. And of course, as we talked about, before we started recording, how mold and bacteria in a home from water damage can lead to all these different health problems. So it may be that you do need to remediate your home, test your home, remediate your home, or move from your home. But to answer your question, yeah, you do need these vacations. So for every 5 to 7 weeks that you live in Chicago, to pick on Chicago again, or maybe to pick on Warsaw or Krakow or something like that, then you got to go to more sunny climates for 5 to 7 days. And if you can't do that, you're going to suffer the consequences. And it's, these are rules that are written by God. These are rules that are written, according to nature. And when you violate the rules, you're going to suffer the consequences.
Yeah, it's so interesting. I used to have seasonal affective disorder in Chicago, and then when I moved to California, it just went away, right? It just went away. And at first I was like, oh, I'm older now or whatever. And then I moved back to Chicago. And I moved back like January. And by March, I'm like, oh, there's that seasonal affective disorder again. And I think just trying to separate ourselves from nature, we have these amazing buildings and beautiful homes, and we can live in very harsh environments by just being in an artificial environment, right? You're inside with air conditioning or you're inside with heat, and you're barely getting that message from nature that it's daytime, that it's nighttime, that it's time to produce hormones, that it's time to, you know, be bright-eyed and bushy-tailed. And I feel like when people spend too much time indoors or in the wrong kind of climate, they end up sicker.
Well, the other thing I would say about that too is that, you want to stack up that summer sun. So if you do live in in Chicago or, Milwaukee, Minneapolis, all these different places we mentioned. So, when the sun's out, I guess what are they, back in the day it was kind of when, you go to the gym, sun's out, guns out, or going to the beach and stuff like that, right?
I thought it was bums out.
And bums out too. I like that too. So, when you have that, you got to really stack up that summer sun. That'll help to create a lot of vitamin D that should carry you through a significant portion of the winter. But, as we said, try and take those vacations. They really are, back in the day, there were smoke breaks that people would take, they'd go out, on their lunch hour, whatever it may be, go smoke, but it's really just a sun break. So to get outside and to go embrace that. But, ultimately, if you're sick enough, you got to change up your environment. And the more drastic you change up the environment, I think the better off you'll do.
Mhm. So we know statins, blood pressure meds, not the way. How do we actually prevent heart attacks and strokes?
So, we do it through the concept of eat well, live well, think well. So, just to kind of reiterate on that, we eat a lot of seafood, we eat a lot of regeneratively raised meats, and we only eat organic plant material. We are hunter gatherers. We drink clean water, we drink organic, mold mycotoxin free coffee. I am a big coffee fan. We just really pay attention to try. The sooner we get to sleep after sundown, the longer and better we're going to live. The more we get outside, the longer we're going to live. The more we avoid the environmental toxins and pollutants, the longer we're going to live. And that goes again back to the plastic. So for example, the recent study that came out that showed that people who underwent what's called carotid artery surgery, so carotid endarterectomy, where they removed the plaque that was inside of the arteries that supply the brain. So they removed the plaque from the arteries, and then the doctors looked under a microscope, and then what they found is that 2/3 of the people had high amounts of microplastics. Surprisingly, 1/3 of the people, they didn't see the microplastic. The group that had the plastic in the arteries had triple the rate of heart attack, stroke, and dying over the next 3 years compared to the people who didn't have it. So that makes plastic a bigger risk factor than smoking, drinking, diabetes, obesity, blood pressure combined times two. So I would be much more concerned about your plastic intake, for example, than most other things. So again, just looking at that whole chemical profile that, as you know, interrupts, thyroid function, leads to so many problems there. Excuse me, adrenal function, etc. So also take a look at chiropractic care. Listen, I became a natural cardiologist. My wife's a chiropractor. Chiropractic, I like to think of how the chiropractic adjustment uses the bones of the spine, the bones, the vertebra of the spine, to make neurologic changes to the brain. And then the brain sends those positive signals back to the organs, for example, including the thyroid that is innervated by the neurologic system. So, and then, to wrap that up, holistic dentistry. Big fan of holistic dentistry. Very, very important, as you know. Also movement, right? The more we move, the longer we live. So all those things. But then you get into the think well component, and you mentioned like seasonal affective disorder, which really highlights how it all interplays in together, how that live well interacts with the think well. It's all very important. I also want to address too that you mentioned the Trauma. So childhood trauma, big, big, big problem as it relates to cardiac disease and all disease. PTSD, but what about PTSD of a medical diagnosis? What if you're a woman who has a history of thyroid cancer or is labeled with Hashimoto's or with Graves'? Like, what role does trauma play even in receiving that diagnosis? And then how does someone deal with that trauma? And if they don't, how does that impact someone, going forward? And I think ultimately, like, that's not my area of specialty. I'm sure it's not your area of specialty as well. And we refer people for that, or we identify, hey, if you're struggling with a medical trauma or any kind of trauma, then yeah, you want to seek out some form of therapy for that. Sometimes it may be professional help. Sometimes if you eat more seafood, get more sunshine, get better sleep, it helps you deal with that trauma that much, better as well. But also I find that there's a lot of healing in prayer, in gratitude, in purpose, in community, right? Just having a like-minded community, or even in your community that you've built, where you've got thousands and thousands and thousands of people, hundreds of thousands of people, millions of people who have seen your information. And knowing that, hey, we're all in this together, and there's other people like us out there.
Yeah, I feel like definitely community can be quite healing. And when you see somebody taking charge of their health or healing something that maybe you're struggling with, this can be quite powerful. Um, and I'm not a psychologist or anything like that, but I don't play one on TV either. But I love EMDR, eye movement desensitization and reprocessing. And it's when somebody works with a therapist and they can essentially process their past traumas, and it really changes their brain wiring. I love neurofeedback, that can be incredibly helpful. And oh my goodness, if you can get enough omega 3s and heal your brain, then you're going to be so much less reactive. We know that inflamed brains are going to be the most likely to struggle with PTSD, right? And to sort of hold on to some of these negative emotions and not be able to process them and get stuck. And so I feel like we have a lot of different tools that I might not be that therapist, but I'm always recommending that people work with a qualified therapist, right?
Yeah, I mean, I think that because with any illness, I think we should always approach things, through that. Okay, well, it's the eat well, eat these foods, avoid these foods, right? So you avoid the MSG and all the artificial colors and sweeteners and flavors and all that stuff. And you don't need a government intervention to get that out of our, diet, because the government didn't help me get it out of my diet, and you the same thing. So it's like, we need to, yeah, read labels. And if the box doesn't have a label, or just don't eat stuff out of a box, to the best of your ability. But if you eat those foods, live that lifestyle, it helps you with your thoughts, as you mentioned. And then, the evidence-based supplements, the advanced testing that we could do to see where things are at, to dial that in, dialing in thyroid, dialing in adrenal. And then, as you mentioned, these different strategies that we could use in that biohacking space to help us deal with the traumas. It's and we can kind of marry those all in at the same time, and that's where they'll get the best effect. And I think that very often, if you don't do everything, maybe not perfectly, but if you don't really focus on everything, you're not going to get the results that you want.
Yeah, I feel like you can get stuck for sure. I would love for us to talk a little bit about holistic dentistry. I feel like a lot of us in functional medicine, the mouth kind of lives by itself separately, and this is not something on a lot of people's radar. But I do know, I think I read an article somewhere how your dental health might be more important to cardiac health than people realize.
Oh, I mean, it's tremendously involved, and there's a lot to go in with that. And I guess ultimately, kind of goes back to when we were kids and how your parents would tell you, not necessarily my parents. My parents, they didn't they would take me to the dentist, and I'd get my cleaning and all the fluoride and all the mercury and the amalgams and stuff. But really, it's just very important about how you take care of your teeth when you're young, the foods you eat, the lifestyle that you lead. It all plays into good oral health. But to your point, when you have periodontal disease, when you have a lot of inflammation in your mouth, it increases your risk of cardiac disease. Recent study that up on the shoulders of many other studies about the benefits of flossing and lowering cardiac risk as well. But all that plays into the thyroid. We know that periodontal disease is highly inflammatory. It leads to thyroid dysfunction, and then, of course, in a um, circular way, is that thyroid dysfunction leads to periodontal disease. So you got to play that all in together, as you know. So seeing a holistic dentist to get your mouth taken care of, very important. I think that things like root planing and dental scaling procedures, I think, are important. But yeah, you got to just find that holistic dentist to get in there. Root canals are something I think that should be avoided. Metal amalgams in many cases should come out, but it is, again, it's complicated. Work and find a dentist that you're comfortable with. But clearly, it is a major thing. And even just eating fermented foods, good oral microbiome. Not using things like Listerine and Scope, and even alcohol can be detrimental to your oral microbiome. So really nourishing that oral microbiome, very important. You can also look at ozone. There's like oral ozone products as well that can be used, injected ozone, a lot of cool stuff.
Do you ever recommend oral probiotics for people?
Yeah, most certainly. I mean, and I think they're very effective. I think that we can often get it from food, and don't forget, kind of going back to the seafood, how the omega-3 fatty acids in seafood helps to nourish the gut microbiome, make things like butyric acid, which is very good for brain, good for cardiac, good anti-cancer stuff. The oral, and eating, fermented foods. So it could be kimchi, sauerkraut, could be drinking kombucha. It could be fermented dairy products like kefir, yogurt, are very good as well. Raw butter, raw cheese, big fan.
Interestingly, I used to be super dairy sensitive, and a lot of people with Hashimoto's are. But then when I had my son, I was breastfeeding and working with a lactation consultant, and I ended up getting taking alfalfa and carnitine, and my dairy sensitivity completely went away. It was just the most interesting thing, and sometimes now I can eat all kinds of fermented dairy, and this is something that I love to utilize, and I think it can be very healthy. Of course, some people that are sensitive, I always encourage them to look deeper. We had mentioned carnivore, right? Carnivore is like a very trendy diet right now, but I oftentimes think about the people who do well on a vegan diet or do well on a carnivore diet is like, what are you missing? Are you missing a digestive enzyme? Because really we should be able to eat a more of a varied diet, right? Or are you missing some kind of a nutrient, or what's the reason behind this? Or do you have something that's out of balance in your microbiome? And how do we get you back into balance so you could really thrive and that not a lot of foods bother you? Of course, we're not going to have you eating crappy junk food, but at the same time, we don't want you to be reactive to things like organic yogurt or kefir, which are very health promoting foods.
Yeah, we definitely, say, try raw dairy, as well. In Texas, here where we're at, it's pretty easy to get raw dairy. It's not available like in every, corner, but it's available. California, it's available. As you said, farmers market's always the best place to shop. So I do think that, raw dairy is good. But, you mentioned like the gut microbiome and the oral microbiome. When I first met my wife in 2005, she said it's about the gut, about the gut, about the gut. And this is really on the heels of my father getting diagnosed with a Parkinson's like illness called progressive supranuclear palsy. Eventually, we wind up at the Mayo Clinic, and the Mayo Clinic has no reason why my father is sick and dying. And they have no treatment for my father. And then simultaneously, serendipitously, I am introduced to this young female chiropractor, and she tells me all the reasons why my father is sick and dying. And it made perfect sense. Number one, it made perfect sense because she's smoking hot. I believed her. And number two, again, I saw all these, things that we never discussed about, food, nutrition, lifestyle, etc. And so it made perfect sense. But she said it's about the gut, about the gut, about the gut. And the way that I think that it all goes down is that all of these all disease, I'll make it, and you understand this as well. All disease is from two things: too much of the bad stuff, not enough of the good stuff. That's what it is. In every single, now, of course, there's trauma, like if someone loses an arm in a boating accident. Nonetheless, Too much of the bad stuff, not enough of the good stuff. So the bad stuff, plastics, phthalates, mold mycotoxins, other environmental toxins, bacterial toxins, they damage the gut microbiome, leading to intestinal hyperpermeability, often known as leaky gut. Then we get inflammation, oxidative stress, immune system activation. We get leaky blood vessels. That leads to coronary artery disease. The thyroid, if you will, leaks, the liver leaks, the brain leaks, the blood-brain barrier leaks, everything becomes dysfunctional, and then disease runs rampant. So to your point, can we eliminate the toxins to the best of our ability? Can we use natural, remedies to repair the gut microbiome? And then once we do that, we're off to the races. We're looking good.
Yeah, it's amazing. Sometimes, like, really approaching the body indirectly results in healing. It's sort of interesting when I first started talking about thyroid health, people were like, "Why are you talking about the gut? Like, isn't the gut down here and the thyroid's up there, right?" And I feel like that's the same for everything because our body isn't like a whole bunch of different organs in a vacuum. They all talk to each other, they all communicate, there's pathways.
But that's not what the medical doctors learn, right? I mean, it's just not what we learn. It's, you've got, all these different specialties. And like I said earlier, it's like they just don't pay attention to each other. But yeah, the gut bone is connected to the thyroid bone. Like it's all connected, as one. And the more we understand that every single cell in our body is talking to every other cell, it just makes perfect sense.
I remember I went to an endocrinology conference and I was on my healing journey and I saw an article in a gastroenterology journal about how every case of autoimmune disease has intestinal permeability, and that's a feature of it. And I remember asking the gentleman at the endocrinology conference what they thought of that, and they were like, "Oh, what?" And they hadn't read those journals. And I was like, "Yeah, do you find that this could be relevant for people with thyroid disease, your specialty?" And they just hadn't read the gastroenterology journals. They were reading the endocrinology journals.
When I first met my wife, and I mean, again, she just trashed my profession right from the get-go. She's so hardcore. And it was like an awe moment. It was like, oh, feel bad for Jack, moment, because you spend your entire life. I was born into the cardiology world. My father was a cardiologist. I'm listening to cardiology conversations as I'm in my mother's womb. And that is a very difficult pill to swallow when you're told that your profession, is a sham or is wrong. But it's like as you kind of learn all these different things, you learn about the root cause, you learn about how everything is all interactive, and then you understand these common sense type things. Um, and as she talks about the leaky gut, and she mentions leaky gut, I'm like, leaky gut? Where did you get this bogus diagnosis from? I went through 4 years of medical school, 3 years of internal medicine, 3 years of cardiology. I'm on the job for a couple years in the biggest group in the state of Arizona as a hospital based cardiologist. I never heard of leaky gut. And she said, well, go read about it, smart guy. And then I go to the medical literature and there's not much there. But over the last 15, 20 years, as you know, the medical literature has exploded on leaky gut, maybe more professionally known as intestinal hyperpermeability, the markers that we could use to test for that, whether it's, zonulin, antibodies to actin, lipopolysaccharides, antibodies to zonulin, lipopolysaccharide, binding proteins, on and on and on that we can use to confirm that diagnosis. And then ultimately, come up with strategies to improve that. And then if you improve those numbers, much as improve Hashi's, antibodies and stuff like that, the person is on the way, to healing. And you may not be able to get the person off their thyroid pharmaceutical, and you may not, desire to do so. But even still, if you're able to quiet down that immune system, that antibody response, it's always got to be a benefit.
And there's connection between that and heart disease as well in the recent years. Is that right?
Oh, for sure. No, I mean the literature. I mean, again, when you have leaky gut, I call it leaky heart syndrome. So you can have antibodies that attack actin, for example. Actin is in the myocardium, right? It's in all muscle tissues. So you go back to the woman with palpitations, or the man or woman with atrial fibrillation. So what is causing that? So if you have these antibodies that are attacking your heart muscle, it's going to lead to abnormal heart rhythms, PACs, PVCs, palpitations. It's going to lead to atrial fibrillation, and of course, coronary artery disease, cardiomyopathy. There was actually a study from the Journal of the American College of Cardiology in 2007 that talked about altered intestinal permeability and congestive heart failure. So it was in the medical literature, circa 2007. And again, to your point, it's just the cardiologist. It's not that they don't want to hear it. Maybe they don't have time to hear it. Maybe they don't believe it. Maybe they don't want to believe it. They don't want to learn the language of health and wellness. And therefore it's like, hey, what's the next drug we can add to the heart failure regimen? And it's just sad.
Yeah, it's a bit of tunnel vision. I mean, I went into pharmacy school wanting to find a cure for a disease, right? And then I realized like it's not just like one drug, right? It's like you have to really look at the body as a whole. That said, I know with Hashimoto's, I have some key go-to things where I would recommend somebody is hypothyroid, definitely getting on some thyroid hormone is going to help you feel better. If somebody is super fatigued with low blood pressure, I might recommend something like thiamine to help them feel better. Do you have some evidence-based supplements that you like to utilize?
Well, it's interesting because obviously the medical community admonishes the use of supplements in so many situations, and it's like, they could be critical of you, and they say, "Oh, Dr. Wentz, there's no evidence," and then all of a sudden you show up with your stack of stuff,
Med.
I mean, and that's another thing too. Like I love the people. Oh, are you a mommy blogger? Did you get your degree from Google? And you're like, actually, yes, because I went on to Google and it led me to PubMed, the medical, database of all studies ever done. And I read the original research, and this is what it showed me. And you, doctor, cardiologist, whatever, you never read that study, but I did. So I think it makes the mommy blogger and the Dr. Google actually very powerful. And I like to say, I mean, there's probably a lot of women and men who are listening to this conversation, and I would sooner send a family member of mine to them for medical advice, health advice, than I would any other cardiologist I've ever worked with.
Wow.
Now, what does that say, right? I mean, I could, it's, I mean, my 17 my 12-year-old son, my 7-year-old daughter, I would send people to health advice with my 7-year-old daughter, my 4-year-old daughter. Over any, now again, if you're in the midst of a heart attack, I wouldn't say go see my son. There is emergencies and traumas and stuff like that, but for real health and wellness advice, yeah, we can go get it. I mean, and to answer your question in a long-winded way, blood pressure, big fan of organic beetroot powder, amino acids like L-arginine, citrulline, taurine, grapeseed extract, that combination, as long as we're all adults here, the heartbeat and the vessel support, that combination are two different ways to increase nitric oxide. So that combination, we call that the boner juice, because it increases circulation in general. And Viagra, as you know from this is before you were in pharmacy school, Viagra came out in the late 1990s. And Viagra is a nitric oxide producer, and prevents actually the breakdown of nitric oxide. So the pharmaceutical company Pfizer, they studied this particular drug as an anti-anginal and as a blood pressure drug. The drug had this very interesting side effect.
Added benefits, right?
This added benefit. And that's how it was born. But it's all about making nitric oxide, and we can do that through two different ways. We mentioned the food-based nitrates. We mentioned amino acids that plug into nitric oxide synthase. And then, of course, the sun, as we mentioned, increases nitric oxide as well. Back in the day, though, I will tell you this. I mean, talk about, and you know this from your days in the pharmacy as well, how the pharmaceutical reps, how they come in and the way that they used to wine and dine us, and still do. But it was certainly, I mean, when my father was starting out in the 70s and 80s, forget about it. I mean, like so many stories of what happened, with him and all the payola and stuff. When Viagra came out, there were a bunch of us residents, men and women, in the in the residence room, And the rep from Pfizer comes in, he throws like a bag of Viagra all over the table. And he's like, here, guys, go have fun with this. Try it out, prescribe it to your patients. I mean, it was just the industry is so dirty, so just so nasty of what that is. But again, there's evidence-based supplements. For example, for lipids, if you want to optimize your lipids, there's things like berberine. As you know, berberine can be very effective. Curcumin, ginger, all these things are evidence-based, and they have good information there. Going on a good quality probiotic can be helpful. You mentioned L-carnitine for cardiac function. You can also get into things like, D-ribose, alpha lipoic acid. There's so many different things that we can use and try after we go for root cause. And I wanted to, again, agree with what you said before, regarding that sometimes people are pretty darn sick and they need to get on that thyroid, immediately, or again, they may need these medical approaches. That can be permanent, but could also be a temporary bridge as we're working on, on root cause. Even men with like low testosterone. So a man may have low T and we want to figure out why, but while we're figuring out why, we may have to get him on something in order to kind of ease that process. And again, once you start allowing the body to function better, then that can, help to eliminate root cause.
Yeah, I love that you have such a wide toolbox, anything from lifestyle changes to nutrition to supplements to medications. And rather than, I know there are some people that will say, never do this or always do this. It's not that straightforward. A lot of times we really need to look at the person as an individual and look at the big picture. And yes, sometimes you might need to bridge them through with some hormone therapy or get them something while they're working on the lifestyle changes, because the lifestyle changes, I feel like for us, they're almost second nature, common sense. My son will be like, "Why do people eat gluten, mom, when they know that it hurts their tummy? Like, don't they know that?" And I mean, I have a 7-year-old son and he is so wise in health that he's just wonders why some of these adults don't know things, right?
But like I said, like, we would sooner send people for health information to your son, like pay your son for a consultation. Someone comes in, they're like a 63-year-old, obese, male with, on 5 different, blood pressure drugs or whatever. And who would they go to? Well, here, do a 30-minute consultation with my son and ask my son questions about what you should eat and how you should sleep and how you should be active and how you should avoid, chemicals and stuff like that. But maybe I'll throw it back to you, because when I started, early on, I thought gluten was a major villain. And we can also preface this and say, like, we don't need gluten. There's no health benefits to eating gluten. But I think that I have evolved a lot. I still don't eat gluten. Maybe if I come across a, fermented sourdough, then I would do that. But I think that gluten in a healthy person is probably less villainous compared to these other toxins now, when, you and I are both so much more educated now about the water damage in a home and the mold and the bacteria, or, EMF or the plastics. Would you agree with that?
Yeah, my approach has evolved a lot. I know when I first was on my healing journey, I was at a point where I got off of gluten and dairy and I felt like, oh, I feel so much better. So therefore, I must eliminate more foods. And I sort of got stuck there and I came back into more balance and learning about gut health and stress response and so many of these other things where I felt my best. And I was gluten free and dairy free for a long time. I'm still mostly gluten free. I do I can't eat sourdough, but I can tolerate gluten now and I do feel like if you're healthy, you should be able to tolerate a whole bunch of foods. It's not like I'm going to eat, like really processed baguettes all day every day. I wouldn't do that, but really my approach has evolved to dialing a lot of these things in that I wasn't really aware of back when I first started. That's the joy of being in this for 10 plus years. I didn't realize how toxic some of the personal care products I was using were, right? I didn't realize that I was deficient in things that, I didn't know you could test for carnitine. I didn't know that you could do organic acids testing to figure out if you have various, mold mycotoxins in your system, or if you have mitochondrial dysfunction. So I've definitely evolved in my approach as well. And now when I see these different diets trending like carnivore, I'm like, absolutely brilliant. I'm so glad this is working for you. But let's think about what else is going on in your gut. Are you exposed? I think a lot of people who are mold exposed, for example, they might do really well on an oxalate free diet. That's because we know that aspergillus mold can create oxalates internally. And it doesn't mean that beets are evil. It just means that your body is overwhelmed with oxalates. And when you're eating beets, which are a high oxalate food, that's going to contribute to that overwhelm. But if we treat the aspergillus and support your detox pathways, the beets are going to be your friends again, right?
Yeah, I mean, I think that and you've seen some of these, women, especially maybe, because I think the women a lot of times they're the canary in the coal mine, because, in that scenario, the woman who doesn't feel well, it's a signal to change the environment, because nature would not want to bring another life into a dangerous environment. So I think that's why the women do have those symptoms, like women who maybe have, whether it's multiple chemicals, sensitivities. Again, like you would have more sensitivity than maybe I would, because your body is telling you, don't think about having a baby in the, detergent aisle in the grocery store. Like that's not a good place, or in a moldy home, or whatever it may be. So that is that, that best way to do it. But for those people, who wind up and they're on your schedule for a consultation or whatever, maybe you get an email and like, I'm down to like one or two foods. Um, and that's, you may have to subsist on those one or two foods in the time being, but even again, as you extend that out to carnivore, which is a restricted diet, and it's not an ancestral diet. There were no lions are not carnivores. Cats, your household, cat, your dog will go outside and eat shrubs or berries. They will eat those foods. So there's no animal in the world that is a total carnivore, and humans shouldn't be either. And you can feel better for a time, you can feel better for a long period of time, but it doesn't make it the right approach. You always need to figure out why, as you mentioned, that if you are high in aspergillus, if you are high in penicillium, if you are exposed to these other mold mycotoxins, stachybotrys, black mold, chitomium, I mean, all these different things. And that's just, again, the mold, not even talking about the bacteria, that if you're in that environment and it's leading to that, the problem is the environment. The problem was not the beets or the spinach or the higher oxalate foods or the histamine producing foods. You got to go after the root cause.
Yeah, I love that. Thank you so much for sharing that. I think it takes a lot of experience and unlearning things to get to that point. People for years have been taking baby aspirin for cardiac prevention. What's your take on that?
Yeah, I think, I definitely am anti-pharma, and people don't have heart attacks and strokes because they're aspirin deficient. It was all propaganda by the Bayer Corporation to sell a lot of aspirin, and they certainly did. As you know, it led to a lot of gastric ulcers and a lot of people bleeding to death and a lot of people having hemorrhagic strokes. I wrote about this in my book from 2015, that aspirin was dead on arrival, total failure. And it was like 2018, there was a large study that was released that looked at aspirin for primary prevention in people 70 and older. And it turned out that more people died in the aspirin group. So it pretty much got rid of aspirin for people 60 and older. Doctors will still recommend aspirin for people 60 and younger if they have multiple risk factors, obesity, diabetes, high blood pressure, so on and so forth. But I think it's horrific advice. I never recommend aspirin. If you do get a stent, and you're after a heart attack, you got a stent, you'll need aspirin and blood thinners for a short period of time, other antiplatelets. But the goal is to try and get off of those with a holistic physician as soon as possible. But yeah, aspirin, no bueno.
Why do you think cardiovascular disease is still the number one killer of people?
Listen, the medical doctors just don't go after the root cause of why people have heart attacks. And It's really it's sad because the life expectancy of an American male is in the mid 70s. Life expectancy of an American female is in the late 70s, and it's just so unfortunate that that's the way that it is. We're built to live, until well over 100 and to live well. And when you follow the medical model, you listen to the advice of the medical doctors, you're not going to make it. You're just not going to make it. So cardiovascular disease, despite all the procedures, all the things, that we do, all the pharmaceuticals, all the stents, all the bypass surgeries, really in general, according to the data from the CDC, our life expectancy is 3 years longer now than it was in 1980. So 45 years later, we've gained 3 years with all of the drugs,
Billions.
all of the trillions, right? All of the stents, all the surgeries, all the bypasses, all the ablations, all the cancer drugs, everything. We've got an extra 3 years. What does that tell the listener? It tells them to work with a holistic, integrative, physician. Your books are amazing. Your supplements, the stuff that you're doing, the videos that we're doing. It's about waking up people to get them out of the medical matrix and into the health and wellness space. And that's where we're going to make just a huge difference.
Mm. Thank you for sharing that. I know people listening will probably want to know where they can find you and connect with you, perhaps get some of your work.
No, for sure. Thank you. You can go to my website, naturalheartdoctor.com. Get information over there. My book is available at freeheartbook.com. We're all over social media. And, listen, I think that, my father died at the age of 63, but his death will not be in vain. It put me on the path that I'm on right now to wake up people to natural heart health. And we'll keep shouting the truth from the rooftops. I think the other side, they try and stop us. They try and shut us down. But I'm on a mission here. God has me on this path to help a lot of people. So again, I appreciate you interviewing me to help get this information out there. So thank you to you.
So now it's time that I put you on the spot and ask you some fun rapid fire questions. What's a wellness hack that you refuse to participate in?
That is easy. Cold plunge.
Oh, yes.
I've got no interest in cold plunging, cold thermogenesis. Frankly, there's really not much data to support it at all. You have a lot of people talking about the benefits, and maybe in the end of the day, it will show benefit. But the whole idea of the Polar Bear Club and like jumping in Lake Michigan, stuff like that on December 25th on Christmas, like, no, I think that's a heart attack waiting to happen. Such a shock to the system. No, definitely not cold plunge for me.
I'm with you on that. Like, I will do a cold plunge if it's a bathtub that's hot with like Epsom salts. Like, that's my modification for it, but it just doesn't sound fun at all. A lot of people, a lot of my thyroid colleagues agree.
Well, especially too, if you're someone who is hypothyroid, like so already like your metabolism is down and you probably suffer from, cold intolerance already. And then you ask people to get into a tub. I think it's cruel. I think it's cruel, not something.
I, I'm totally with you on that. How about the most outlandish things you've ever tried for your health?
Oof. Well, colonic therapy would be up there. That's for sure. Personally, I think enemas are okay. Colonics, not something I'd recommend after doing it several times several years ago. That I guess I would consider outlandish. We do eat a lot of raw organs, and I guess other people would consider it outlandish. But if you watch some of my social media videos, and especially with our girls, a friend of mine, he was an orthopedic surgeon in Las Vegas. He went on a hunt, killed an elk, and he sent me the heart. And so I made a video eating of me frying up the heart. But before that, I cut it up and I was eating it raw. And then my girls were in the room and I'm like, who wants some raw elk heart? And they're like fighting over it. And it was so unscripted. They're like, me, so we do eat the raw organs. That's kind of outlandish. What else? I try and run around naked out in the sun, too. I guess some people would consider that outlandish.
You get lots of vitamin D that way. Where can we find you on social media?
Yeah, so I mean, on Instagram, TikTok, Natural Heart Doctor, is there. We have a Facebook group as well, that people could go to, all under Natural Heart Doctor.
Perfect. Well, we make sure to drop that in the show notes. And do you have any guilty pleasures that maybe aren't doctor approved? Like somebody might be like, "Ah, is that Dr. Jack Wolfson? What is he doing?"
That's a great question. And listen, life is to be enjoyed. And food is one of those enjoyable things. So if you're going to eat ice cream, which most people are going to, just get organic ice cream, right? Get Strauss's free range grass fed ice cream. Make your own ice cream with raw dairy. What is that? Raw egg, raw cream, raw milk, raw vanilla, and raw honey, for example, and put that into your ice cream maker. I rattled off the recipe pretty easy because I've done it many times. And that's okay. And in that sense, there's so many health benefits, to that. Chocolate. I think chocolate is a medicinal food. Coffee, I think, is a medicinal food when done the right way. So I'm not saying go out to Starbucks and drink a frappuccino, but if you like coffee, the medical literature supports the use of coffee, and that is on the fast food variety of coffee. Imagine how well people would do on the high quality, organic, glyphosate free, mold mycotoxin free coffee. And I think the medical doctors, they tell their patients not to drink coffee, yet they turn around and they drink coffee at the nurse's station. We used to do out of a styrofoam cup. But I don't want to say that it's a guilty, people maybe feel it's a guilty pleasure, but actually coffee is medicine.
I love that. And you actually have a coffee brand. I'm going to link to that in the show notes. Can you tell us more about that?
Oh, you're so awesome for that shameless promo. No, so what happened was that my father was a coffee drinker back then. It was Hills Brothers in tin cans, and then I started drinking coffee at a young age. And I'm not promoting people drink coffee to, I'm not promoting coffee to children. I'm not promoting people drink coffee if they don't like coffee, but if they like coffee, drink the good stuff. So what happens is that I meet my wife and I start drinking organic coffee, but she would come across like you and she'd say, coffee's not good for your gut. Coffee's not good for your adrenals. Coffee's not good for your hormones. Coffee's an addiction. And all that stuff could potentially be true. But even still, it was like I would be on call. I wouldn't sleep all night long. I needed coffee the next morning. I felt like I needed it. And I choose to do it. But it became always organic. And then I started speaking for another coffee company talking about the heart health benefits. And then I said, you know what? I'm going to do my own thing. So I went to a company. They get this single source from a Honduran farm. We tested it to make sure that it is organic. It's glyphosate free. We tested it for mold mycotoxins. It's mold free because I want to drink it myself. I want my wife to drink it when she's interested, and I want other people to drink it. So that's how that was. And it comes from a single source Honduran farm. It was started as a women's co-op, so it's owned by women. They started on like 3 acres of land in order to, again, help to support those women and get them out of poverty. And now they've got like a 75-acre farm. That's where we get our beans from. And then we also donate back to a group called Friends of Honduran Children. We give back 5% of all proceeds, not profit, but all sales revenue goes to this organization. And of course, I vetted the organization to make sure they're doing healthy things with the money, and they are. So yeah, it's pretty cool. And actually, again, like, when it comes to, if you don't feel well with caffeine, then don't use it. But if you like it, there are definitely heart health benefits: lower stroke, lower AFib, lower blood pressure, cardiac longevity. Recent studies showed that people who drink between 3 and 4 cups of coffee before noon have a lower risk of dying. So there you go.
Interesting. Thank you so much for sharing that. I can't wait to try it and share it with my family. Everybody, thank you so much for joining Thyroid Pharmacist Healing Conversations. I hope this has been a part of your healing journey. Thank you, Dr. Jack, for being here with us today.